In our series Medical Price Roulette, in collaboration with Clear Health Costs, we're going to tell you how some hospitals are now suing patients to collect their medical debts. Many people use payment plans when they're hit with bills they can't afford to pay, but we learned some hospitals are seizing patients' tax returns, withholding portions of paychecks, and collecting interest on top of the initial medical bill. Our consumer investigative correspondent Anna Werner visited a community where one hospital has filed hundreds of lawsuits. Anna, they really want their money, it seems like.
Yeah, you know, you work hard, you pay your bills, you try to get ahead. But what if an unexpected medical bill threatens your livelihood, maybe even your health? That's what one couple say they've been going through.
At their T-shirt screen printing company outside Dothan, Alabama, Daryl and Casey Roberts are struggling to stay afloat.
How's it going?
Slow. Businesses are closing. People are not making money like they used to be.
In 2015, the couple found they could no longer afford health insurance. Casey said she had a choice between paying the premiums or taking her son out of college.
I wanted my son to have a better life than I had. So what do you do as a parent? You sacrifice.
Casey says she'd been healthy, but in May of 2016, she had an attack of severe abdominal pain.
When I say I felt like I was dying, I felt like I was dying.
Her husband rushed her to local Flowers Hospital.
The doctor told me she needs to have this surgery now.
Her appendix was about to burst. She needed an emergency appendectomy. A few weeks later, the Roberts got the doctor's bills, which didn't surprise them. They came to a little under $3,000. But then the hospital's bill arrived. The charge, over $52,000. Even with a supposed discount for uninsured patients like Roberts, the total still came to about $31,000.
I thought it was crazy. That's a house in Alabama in this area. That's a house.
But she and her husband still paid the hospital what they could, $25 a month for nearly 3 years.
As long as I can work and they'll accept payments, we're going to pay, because everything that we've ever had in life, we've paid for.
Yes.
Then in September of 2019, the hospital sued them for the entire balance plus interest. The total, nearly $37,000. At that point, Casey says,
I told my husband, I wish you to let me die.
How can you even think that?
I've told my husband this. I've said, honey, I love you and I love my family, but if you have let me go, today you would not be going through this.
But what she says she didn't know was that original $31,000 bill was likely much higher than what she would have paid if she'd had insurance, and some $25,000 more than what Medicare would be charged by a hospital on average for an appendectomy, just $5,800.
It seems like they're taking advantage of people who don't have insurance. And I say you ought to be ashamed of yourself. Why would you even do that?
And they're not the only ones Flowers Hospital has sued. CBS News found last year the for-profit hospital sued more than 1,500 people. It's not clear whether all the lawsuits were over medical bills. But in one letter to the court, a mother of 3 wrote with her $11 an hour paycheck, she couldn't afford the over $11,000 bill for emergency treatment.
I think it's despicable.
Attorney Christy Kirkland works on those kinds of cases at the nonprofit legal services of Alabama.
They're going to be paying it forever, or at least for a very, very long time. This is not a debt that they're going to be able to get out from under very quickly.
In court, Kirkland says usually the best she can do is get their payments stretched out over decades, what the attorneys here call the slow bleed.
Some of these people will be paying $5 or $10 on their debt until the day they die.
We wanted to ask hospital officials about their prices and all of those lawsuits.
CBS News.
We were told to make an appointment.
I'd like to see if he'd be willing to speak with us on camera. Okay. For the story. Okay.
The next week, they turned us down. Instead, they sent us a statement saying they try to work with patients, but some individuals refuse to engage with us to resolve their balances. Litigation is always a last resort and used only, they said, for patients who can afford some level of payment. Meanwhile, Casey Roberts has a large, painful lump growing on her shoulder.
I have not been to the doctor. I can't afford it.
Do you think people like yourself should be having to make those choices?
It shouldn't be that choice. But unfortunately, that's the world we live in.
In its statement, Flowers Hospital told us it offers interest-free payment plans for some patients and looks to see if they're eligible for charity care or Medicaid. The Roberts faced a default judgment on this in January, essentially a court order to pay, but they've since contacted Legal Services of Alabama, and attorneys there got that judgment overturned. It doesn't solve their problem, but gives them a chance perhaps to try to negotiate. And by the way, you know, the hospital said that some people refused to engage with them, but Casey Roberts says she tried to she reached out to the hospital 3 times. They said they would call her back, and she never did get a call back. This was early on when she first got.
Roberts are telling a very different story, very compelling story.
That big bill. And by the way, we want to hear from people. If you've been sued by a hospital, have a similar story, please email us at healthcosts@cbsnews.com.
And I realize the hospital is running a business. I get it, but there has to be a better way to do business when you see people's lives are on the line. Just the fact that she has that lump on her shoulder and doesn't want to go, which, by the way, Mrs. Roberts, you got to go to the doctor about that.
Which is what we said.
But you can understand how she wouldn't want to go. And there are a lot of people
it.
who say, no, the healthcare like that should not be a business.
And what's particularly alarming in this, among the many things that are alarming, is the discrepancy in what they bill for that surgery. I mean, it ranged from $5,800 to $31,000.
Very good
Yeah,
point.
I mean, if somebody with insurance, okay, I had a procedure last year, and the bill that the insurance company negotiates is like $19,000, but you pay $1,000 of that. So you don't pay $19,000 on your procedure. You're never going to pay that amount of money with insurance.
Which is why the health care debate is so important as we get ready to go to the polls. Thank you very much, Anna.